Ecohealth hotspots project began around 4 to 5 years ago, when we received a call from the IDRC to submit a project regarding emerging infectious diseases in global outreach hotspots. In the Philippines, we selected Puerto Princesa because it was becoming a top tourist destination in the country, and there were a lot of ecotour sites which are being put up by the local governments. We decided on also using dengue as a proxy disease to illustrate how changes in the environment would affect people's risk for emerging infections. So this project entailed working with several local government offices and also Department of Health agencies. We had to go through offices which RITM had not dealt with before in any of its research, because we had to look at the full spectrum of how this project we would set up and the interventions would work in the end. So it entailed getting permits from the Palawan Council for Sustainable Development, the Department of Environment and Natural Resources, from the City Health Government, in addition to the Ethics Review Board of the Research Institute of Tropical Medicine. So we put up two main interventions. One was to improve the dengue surveillance of the city, and because the surveillance previous to the project was almost non-existent. The second intervention we tried to set up was to empower and teach the community in one ecotour area, which is the Palawan Underground River Tour. This is the Puerto Princesa Underground River Tour. So this area sees a lot of visitors per day. At almost 1,000 people enter the caves. So and roosting in those caves were a lot of bats. Plus, the area was also one wherein people were also exposed to malaria. However, for this project, we focused on the potential pathogens that they would get from the bats. So we taught the park rangers on how to collect, first on how to identify the species of bat in the area, how to do a general overview or do a general monitoring of their health, and also how to collect specimens from them. We also taught the communities in the villages on how to do entomological survey. And this was important for us to know just how much the threat of dengue transmission is in the area. So we taught the volunteer community health workers on how to inspect water containers in their homes and also in their neighbors, and also structures which were found in 4 selected villages. So we did the entomological survey. It was actually carried out by the community health workers. They did this during the rainy season and the dry season. We were able to teach them on how to identify pupa, larvae, and also how to speciate the Aedes, whether it's Aegypti or Albopictus. Puerto Princesa City and the province of Palawan are now with one of the 11 sentinel sites for dengue surveillance. This is quite good because now they can actually have good data on the dengue situation in their areas. I think an important output with this Eco-EID program was that it brought together people or individuals in offices that normally do not sit down and talk with each other. It has shown that it was very important for any emerging infections. If you take an eco-health approach, you can't do it alone. You have to work with others and you have to collaborate for a common goal, to achieve a common goal.